Right, the Biden administration continues to seek any and every avenue that it can to push its abortion on demand. Now, you've heard me discuss the FDA recently changed its rules to allow pharmacies to become abortion facilities and distribute chemical abortion pills. In fact, thousands of you have already signed the petition, and if you've not done so, I invite you to do this. Because Walgreens, CVS, they've stated, they immediately came out, same day that the FDA announced these new rules, they came out and said, hey, we want to do this. We're going through the certification process. We want to turn our neighborhood pharmacies into abortion facilities. I mean, they didn't say it like that, but that's the effect. So if you'd like to communicate to the heads of CVS and Walgreens, here's what you need to do. Simply text the word pharmacy, that's PHARMACY, pharmacy, to 67742. 67742. 67742, the word pharmacy. You'll get a link, follow the link, and you can sign the petition, or you can go to tonyperkins.com. Well, in response, House Republicans have put forward a bill that bars employers or government from harming any health worker who refuses to fill a prescription they believe may be used to cause an abortion. Joining me now to discuss this and more is the co-author of the bill, Congressman Buddy Carter. He serves on the House Budget Committee and the House Committee on Energy and Commerce. He represents Georgia's 1st District, and for more than 32 years, he owned Carter's Pharmacy. See, he knows what he's talking about, and he's trying to help the community of that. All these pharmacies are really central to community health. So joining us now by phone is Congressman Carter. Congressman, welcome back to Washington Watch.
Well, thank you for having me.
Before we go to your bill, yesterday, big day in the House with the Republicans after 80 attempts being blocked by former Speaker Nancy Pelosi. Within less than 8 days, the Republicans passed the Born Alive Abortion Survivor Protection Act.
Yes. And I tell you, I was proud to vote for that, and I was proud that we passed it. That's good legislation. I mean, obviously, we in the Republican majority are intent on protecting life, and this was our opportunity to protect those centers that have been attacked since the ruling by the Supreme Court of Dobbs. And what we've seen is an uptick in violence against some of these groups, and they need to be protected, and that's the intent of the bill.
Yeah, that was the two measures that passed yesterday. Now, before I go to your bill, I want to play a clip from Congressman Jerry Nadler of New York, who was telling the Congress why Democrats were voting against the Born Alive bill. And I need you to interpret this for me, because I can't understand what he's saying. So play the Nadler clip, please.
That's why we oppose this bill, not because we don't think that babies born alive must be saved, but because we do think that babies born alive must be saved.
Can you explain that to me, buddy?
I'm afraid I can't. It makes no sense whatsoever, which is typical for the Democratic response to this, and typical for the Democratic view on abortion. They say they care about life, but yet they continue to push for what they say is pro-choice, and to give women the right to control their bodies. Look, I'm a pharmacist and a healthcare professional, and we're trained to do no harm.
Right.
And that's the Hippocratic oath that healthcare professionals take. And it's just, again, it's just the typical Democratic response when we start talking about abortion.
Now, you and 25 of your colleagues sent a letter to the FDA last week because, look, the abortion industry is in retreat when it comes to what they've been doing for years in these abortion clinics, Planned Parenthood. So they're resorting to turning pharmacies into abortion facilities. And you and several of your colleagues sent a letter to the FDA calling on them to rescind this decision. Give us the status on that.
Well, we did send the letter in, and thus far we haven't gotten a response. Of course, it hasn't been very long, but in all fairness, but at the same time, this is not the first time that we've done it. We've sent letters in before protesting this. When I was practicing pharmacy and I had a pregnant woman to come into my pharmacy, I was treating two patients. I was treating the mother and the child. And that's the way pharmacists are trained to look at this situation. We actually have two patients here. It was my responsibility to warn that mother if this medication would potentially harm that child. It was my responsibility not to dispense a prescription that was going to have a harmful effect on a fetus.
But the way they're treating this is that you're just another cog in the process, and you just have to mechanically do what someone else tells you to do.
It's as if pharmacists are nothing more than vending machines.
Right.
And if that's going to be the case, then they should be, just replace us with vending machines. Of course, I'm being facetious when I say that. But, when I was serving in the Georgia State Legislature, I passed legislation at that time and sponsored legislation and had it passed at that time that would prohibit a company from disciplining a pharmacist who refused to dispense a prescription that they knew was going to be used for an elective abortion, or that they knew was going to cause harm to a child. And there are state laws on the books for that. But, with the direction that this administration and that HHS are taking right now, we need even more protection.
Do you think you'll be able to get a measure through the House to do that?
We are. I have introduced the Pharmacist Conscious Protection Act, and essentially what that does is it's just another layer, if you will, of protection for pharmacists. As I say, there's already the rules on the book and laws on the book that would protect pharmacists, but we need even more if this is going to be the attitude, if you will, the direction that this administration is going to take. But what the Pharmacist Conscious Protection Act would do, it would strengthen the pharmacist's conscientious rights when they're choosing whether to fill a prescription for elective abortions. And it would provide them with a private right to action so that pharmacists who object to dispensing that prescription or even keeping it in inventory. When I own my pharmacies, I refuse to keep some of these medications in inventory.
Well,
I knew what they were going to be used for.
Given the policies of this administration, it's critical that we provide those protections to the medical professionals. Buddy Carter, we're out of time. I want to thank you for joining us and look forward to tracking the process and progress of that bill.
Thank you very much.